Hi, everyone. It's Dr. Jacqueline Cortez Salmons here at Transformation Health and Wellness. Welcome to Wellness Wednesdays. I'm glad you're back joining us. Today, I wanted to really talk a bit about how to arm yourself from an immune standpoint to help to fight off this COVID crisis. I'm not sure if I'm looking at the right area. I'm always struggling with this one. Anyhow, so we want to really get the ability to have our own power back, to really empower ourselves within our health so that we are not having to rely so much on mainstream medicine, kind of waiting for our doctors to get with the program, waiting for those randomized prospective studies. Those things take years, guys. I mean, I know it's really frustrating to be listening to the news every day. They're coming out with something new. Oh, we're going to do this with the vaccine. We're going to do that with the treatment. Nope, sorry, that treatment's not good anymore. We're going to do something else. And it sort of leaves us all very anxious, which again leads to more cytokine release, leads to more of that cytokine storm or potential for cytokine storm. It leaves us more susceptible really to becoming infected, especially when we have the anxiety, we have the social isolation, that we're staying away from other people. That increases our cytokine response and also decreases our immune function. So I really want to design this in such that you can start to develop your own armor, your own ability to protect yourself from this virus and then from many others, right? So we become very narrow-sighted, very myopic, so to speak, as one of my optometry friends likes to make the pun. And we're looking at one thing. We're looking at COVID. But let's remember that COVID is part of the coronavirus family, which is a number of viruses, like tons and tons and tons of strains within the coronavirus family. There's rhinovirus, there's enterovirus, there's respiratory syncytial virus, there's Haemophilus strains, there's influenza A and B. There are so many other viruses that are out there that are equally problematic for that immune compromised person or population, I should say. So then how do we best give ourselves those tools to really armor ourselves and kind of build ourselves from being susceptible to these infections? So that's what I wanted to talk to you about today. So one of the main things that you've heard me talk about before, and I strongly believe in, is vitamin D. Vitamin D is immensely important. Again, when I was in medical school, you'll ask kind of, why don't other doctors talk about this? What's wrong? Why, how come my doctor hasn't said anything? And part of the problem is that actually the vitamin D, what we're taught in medical school is it's good for bone strength. It helps you with calcium absorption and helps you to deposit that calcium and build your bones. Yay, go vitamin D. Okay, we get our vitamin D from sunlight. It gets synthesized actually in the skin through a variety of enzymes and then gets transported to your bone tissue, to the intestines actually to absorb the calcium and transports it. And that's it. That's all we ever learn about vitamin D. So if you saw vitamin D on a test question, you'd basically circle bones, or vice versa. If you see bones on the test question, you circle vitamin D. Done. But since then, we've actually learned that vitamin D is substantially involved with a number of other immune complexes. It's important in cell membrane function. It's important in brain function. So really, vitamin D levels need to be looked at a lot differently than how they've been looked at in the past. The normal range that's been set for vitamin D has really been from like 30 to 100. Well, below 30, then we start to get fractures, like with rickets is what's most concerning, and then osteoporosis, osteopenia, osteoporosis, I should say it in that order. And so then that we don't want it below 30, right? And then above 100, we start to get vitamin D toxicity. Well, really, that's not the optimal range, though. That's a normal range for you not to get bone fractures and not to become toxic, but it's not really where your body functions at its best. So really where it's going to function at its best is much more in the range of about 70 to 80. So we really want to get those numbers up much higher. So when your doctor tells you, hey, your vitamin D level was normal, I would encourage you to please ask, what is my number? Give me an actual number. Don't just tell me normal. Tell me what is my actual number. And then you can take this information and say, well, I'm at 32. So technically, I'm not going to be spontaneously fracturing my bones, but I'm not really optimal either. So that brain fog that you have, that susceptibility to colds and flus and infections is still going to be there. So we want to make sure to get that level up to around 70 to 80. Okay. Next thing that we want to talk about that we've also learned an immense about in the last several years, and again, the literature is out there, guys. I try to really make sure to give you some literature references, some actual articles that are out there. That's what I try to do in my evening posts so that you can read for yourself. I mean, y'all, we know how to read, and oftentimes when you read just the abstract of an article, it will give you kind of the rundown. It's like the overall synopsis, and you can gather a lot of the information from an article just from that abstract. So that's what I give you the links to. You can get into the materials and methods and how they ran the statistics and all the craziness, and that's what your doctors are trained to do. That's what research scientists are trained to do. So you certainly have to get stuck in the weeds, so to speak. But definitely reading those abstracts can give you some of those take home points. And same with the whole body of the article. I'll try to actually outline and highlight for you what I think are some of the important aspects of that article so you can have that best take home message and be able to utilize that information to the best of your ability. So coming up next is zinc. And again, there's a lot of literature out there supporting zinc. Now, again, zinc, we just used to think is like, hey, it's a mineral. We're supposed to be having it in. It's one of those heavy metal compounds that we're supposed to have in our bodies. Thanks. Not much else information was given to us through medical school. But what we understand now is it actually has over 2,000 applications within the biochemistry of our bodies. That's immense, guys. That's huge. I don't even think when I was in medical school, we understood that there were actually 2,000 things happening. Okay, I'm just kidding. But we actually do have a number of factors that zinc is involved in as far as the Krebs cycle is concerned, as far as the cell membrane functioning, allowing things into the cell and keeping things out from the cell. Now, again, we have to be very cautious, and you have to use zinc under a physician's guidance, preferably one who understands the utility of zinc, because you can get too much to where it is then causing issues with iron absorption and with copper absorption. So I have a patient I just saw this morning. Hi, if you're listening. And he is having a low iron issues. And so I don't necessarily want him on high doses of zinc. We're going to then support his immune function from another angle, but we want him to be able to have that adequate absorption of iron. So that's something that we need to be very cautious of. So definitely use zinc for immune building, but you want to do it under a doctor's supervision. Okay. Another really important element is vitamin C. Vitamin C is, again, one of those things that we would get through our diet, particularly through citrus and fruits and vegetables. But we kind of have gotten away from that. Again, a lot of times the foods that we're eating aren't even real foods. They're processed and packaged. Anything that you're crinkling out of a package or you're having to heat up in the microwave is probably not like real food. And I'm just as guilty as anybody of eating those things. We love those things, but they're not helpful for us and they don't have the nutritional value that we need. So oftentimes that's why we need to supplement with something. So vitamin C, again, in study after study after study, has been shown to be beneficial for immune function. It has been shown to help with tissue repair. It helps to minimize actually number of days in the ICU. Sorry for the phone. It minimizes days in the ICU. It minimizes hospital stay. So something that's very important to look into taking vitamin C in your normal regimen for immune support. Okay, we also offer that here in the office through IV if you're interested in that. Okay, let's see. I made some notes. We want to make sure not to miss anybody. Our B vitamins also are immensely important for our immune function. Again, they're involved in so much of our ability to function on a cellular level, and we need those B vitamins in there in order to process peptides, in order to tell our body what's appropriately coming into our systems and what needs to stay out. So that triage, so to speak, you come in, you don't. They're like the bouncers. Okay, so again, B vitamin supplementation is super important. And again, one of those things with B vitamins, you can't really overdose on B vitamins. I mean, don't go try it, right? But again, oftentimes it's very water soluble and we'll just kind of pee off the rest. So that's if you are taking any multivitamin, you see that fluorescent yellow urine, it's from those B vitamins typically that your body's not utilizing. So it means it's either absorbed as much as it can or it's not really absorbing to the best of its ability. And that would be why we want to check those B levels in our office, see what your B5 levels are, see what your B12 levels are, and see if you're optimal. So again, there's the normal range and then there's optimal range, which is usually a much more narrow range. Let's see, we have a question. Dosing and when for zinc, vitamin C, vitamin D. Oh my goodness, all these awesome questions. So zinc, again, what I normally recommend is about 40 milligrams a day. And you'll want to do that for a good 4 to 6 weeks and then have your levels checked again. Now, an interesting thing that I've only learned recently, because in medical school, they actually didn't teach us this. We have a level called alkaline phosphatase, and that's typically looking for liver dysfunction, liver inflammation, that kind of thing. But other than that, you kind of ignore that number. But it's actually sort of an indirect measurement of zinc. So even if you haven't had your zinc measured directly, you can actually infer what it is based on what that alkaline phosphatase level is. So again, if you've gone to your doctor, you've had annual labs run, they've run a chemistry panel, including liver function tests, they probably have an alkaline phosphatase level. They probably have not looked at it twice. Unless it marks as being out of range, they're not going to really look at it because we weren't taught to look at it or to interpret it unless you're really a hepatologist or a liver specialist. But again, looking at that number, we want that number to be around 70 or higher, and that's going to tell us we're getting adequate zinc absorption. Okay, so again, coming back to gut health, and it's a whole different topic, but with gut health being impaired, you could be taking zinc supplements all day long. You're not going to absorb it appropriately if you don't have good gut health. So super, super important that you follow those numbers to a degree. Don't obsess about it, but we want to follow those numbers to a degree to make sure that you're absorbing enough, you're not getting too much, you're again not impairing your copper and your iron absorption. So we want to make sure that those are stable. As far as vitamin D is concerned, the very, very minimal amount would be 1,000 international units. Again, vitamin D insufficiency or deficiency. So again, two differentiated things. You might be a little bit on the low sides. You're like insufficient, but not deficient. So will your doctor address it with you? Likely not. And it's not because they're bad physicians. It's really because they're just not familiar with the same level of literature that I've looked into. So, cut them a little slack. But again, educating yourself and knowing where your levels should be is super important to be an advocate for your own health. So with that, you want to be taking at the very bare minimum about 1,000 international units a day. Probably better to take 5,000 per day, or you can take 50,000 international units per week. Okay. So again, you can get toxic. So you want to pick one, right? You don't want to be 50,000 plus 5,000 per day, but you can do the 50,000 units per week. You just take it on Sunday or whatever your favorite day of the week is, and get yourself dosed up. And that's going to help prevent viral infection. Actually, if you get presented with a virus and get it into your system, it actually changes the cell membrane such that it's like, dude, we don't want you here. And so it's a really nice manner of making sure to keep you protected, okay? We sell that here in the office at the 50,000 international units. It's in this little dose pack. And so you can actually share this amongst family. It's 15 in the packet, so that'll take you all the way through like a 4-month period, if I do the math right, yeah, about 4 months, if you're taking it on your own. Otherwise, you can share it amongst like 4 family members, and each one gets about a month's supply. If you're doing a vitamin D hammer, which is where like, oh my gosh, I'm feeling sick, I'm not doing well, I've got a cough cold, then we want to make sure to kind of walk it back and hit it really hard. Then the vitamin D hammer is 50,000 units 3 days in a row. Okay, so 50,000, 50,000, 50,000, that's going to really get us ramped up on our level of the vitamin D and make sure that you're then able to sustain that on the 50,000 per week. Hi, Jeremy. Yes, the IVs, he says, it make a really huge difference. They absolutely do. It's one of those things where I think a lot of mainstream medicine, even myself included, before coming into this level of the profession, I was like, really, do you need an IV? Like, is that really necessary? It's invasive. There's potential for infection. And there absolutely is that risk. But that being said, when we infuse that IV fluid with vitamin C, with zinc, we can't put vitamin D in there, but we put things like glutathione, B complex, B12, magnesium chloride. There's a number of things that we can add, and in certain combinations actually really ramp up those levels within your system. It really perfuses into the tissue. We're bypassing the gut. So again, for those of us, a number of us really, who have gut health issues, we're not absorbing. So we're taking all this vitamin C, we're getting ourselves sick to our stomach, diarrhea, stomach cramping. We're not absorbing it into our system, so we're not getting the benefit. But if we can bypass the gut and get it in through the IV, it actually gives us a huge benefit, and then we're able to incorporate it better into our system. So yes, there is a huge benefit to that therapy for sure. As far as vitamin C, typically what's tolerated is about 500 milligrams, which is kind of a squeak of a dose, really. And then again, it depends on how much you can actually absorb into your system. So you can take 500, you can take 500 twice a day. I've had some patients who've actually titrated up to where they're taking about 2 to 3 grams. So that's 2,000 to 3,000 milligrams per day to help support their immune system. And that's probably a better functional level if you can get there. But again, it comes down to a GI tolerance. Can you tolerate it without getting nauseous, having diarrhea, really having a lot of side effects? When we do it through the IV with vitamin C, we typically give you about 5,000 milligrams. So about 10 times the dose that you're able to tolerate orally. Okay, so we can really get you up there with those levels for tissue repair. Typically, when I have a patient who's kind of sick, they're under the weather, they've had a cough, fever, punky, they don't feel well, whether it's COVID or any other thing, because we've only just started testing for COVID. But even with any kind of viral funk, they usually feel better after an IV after about 30 hours. I mean, I've actually timed it out. And again, it's not a broad study, it's not randomized, blah, 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 but they really perk up and feel better after about 24 to 36 hours. So if I give it to you in the morning today, by tomorrow afternoon, you're feeling pretty darn good and you're ready to get out there and function and be in the normal space. So it's really reassuring that we are onto something really good here and being able to do that. And then let's see, Jeremy says I take 10,000 a day. And again, depending on it, I'm thinking he's talking about vitamin D. And I'm thinking with that, again, depending on your starting level, right? I've had patients with a vitamin D level as low as 12. And when you consider that a normal level is about 30, that's really, really deficient, particularly when we're looking for a target of 70 to 80. And so with that, we want to get that vitamin D level up. And so again, taking 10,000 international units per day can be something that you can benefit from, but we want to follow those levels as well, make sure we're not getting into toxic ranges. And again, it comes down to that GI gut absorption. So if you're taking 10,000 for a long period of time and you're still not getting those levels of vitamin D up to where they should be, you're probably not absorbing. We need to walk it back a little bit and talk about your GI health and how we can restore that flora. Okay. So that's another thing. And then let's see, B vitamins. B vitamins are really kind of an interesting way of dosing. Actually, when I look at it, it's like some are 1,000 units, some are, 10,000. B complex just is like, hey, I'm just B complex. Don't even judge me. So really, it's kind of what can you tolerate? Most people tolerate B vitamins very, very nicely. There's not a lot of ill side effects with them. And like I said, they're water soluble. So you just kind of pee off the excess that your body's not absorbing or can't utilize. So again, something that you should do on a routine basis is take your B vitamins. It's usually within a multivitamin. And so look at that breakdown of your multivitamin and make sure that you're getting some B vitamins in there. B6 can be really helpful for nausea. So there's a lot of elements to those B vitamins that can be very helpful. Okay. And then lastly, what I've looked at, again, aside from gut health, which we'll talk about in another issue. So again, I have a probiotic here that I absolutely love. I actually have several probiotics here, but there's one I really, really love. Very well tolerated by my patients, a very good quality product. But quite honestly, if you're there and you're in Minnesota and you're not talking with me on a daily basis, then any probiotic is better than no probiotic, really. So find the one in the grocery store that you can best tolerate. But other than that, I like Microbiome Labs is the company that I use, and it's called Mega Spore Biotic. I like it because it's in a spore form. So instead of taking a live culture of bacteria, which our body is designed to attack and destroy, it actually kind of sneaks under that immunity radar because it's in a spore form. So it's still a capsule, but the little critters inside microscopically, they're in a spore form, which is like a bacterial cocoon. So that bacterial cocoon kind of gets through the first part of the intestinal tract or the duodenum. And then it starts to flourish. It opens up and it's like, hey, I'm home. This is where I'm supposed to be. And it gets very excited and it begins setting up its apartment complexes, kind of kicking out the bad bacteria, making its own colony forming units and starting to repair that intestinal lining. And that's going to make a huge difference as far as your immune system is concerned. Okay. Let's see. Okay. And so that's one of those things that you want to look into is getting onto a good probiotic. Again, discuss it with your regular physician. I absolutely encourage that, but a lot of times they haven't looked at the literature. They'll say that there's no literature to support that. Kind of not the case. There is literature to support it. They just might not be familiar with the study. So you can do your own PubMed search. I prefer things that are through NCBI, NIH. Those tend to be the more reputable studies, the ones that are peer reviewed and they're out there in the literature and so forth. So it's not hard to find. Honestly, a lot of the research that I do is through public searches. And then I discern kind of what information is important, what's not. And I think that that's why physicians will never be obsolete. Even with all the benefits of the internet searches that we can do, we can educate ourselves quite nicely. I can help you discern, like, well, this is important for you in your case because of X, Y, and Z. This is not as important for you or not as relevant because of A, B, and C. And so I think that's why it's important to have that open discussion, or even bring a copy of your article. If you have a physician who, wants to learn, but maybe they don't know or aren't familiar with the literature, hey, doc, I found this article. Maybe you can take a look and tell me what you think about it. And maybe they'll be receptive to it. Maybe they won't, but hopefully they'll be receptive to it and kind of help open up that conversation with you so that you can get your best course. Another question is any other ingredient recommendations beyond vitamins and minerals? We just talked about the probiotics, which are super, super important. But another really critical thing that has kind of just come out, it's like hot off the presses, right, is something called bovine colostrum. So for those of you who have ever been breastfed or breastfeeding moms out there, usually not breastfeeding dads, so not to be exclusionary, but y'all don't do that. But the colostrum, which is that particular milk that is present in that first couple of days of breastfeeding an infant, is super, super, super nutritive. It is super protective to that newborn. It helps that newborn to establish its immune function because it's really been so reliant on mom for the 10 months of gestation, and it's 10, not 9 months. But for those 10 months of gestation, it comes out and it's like, oh gosh, what is this planet? I don't even know how to address everything that I'm being hit with. And so that colostrum really helps them. Bovine is from cows. Okay. So that's the cow version mammal of us. And so we're able to have that colostrum then sort of brought down into its immunoglobulins. Those are the elements, the immunoglobulins are the little proteins within that colostrum that help to give us that protection. So while cows are not people, there's always that argument, well, why would I want a cow anything? But again, they are still mammals. They do have that same process of antigen versus antibody, or antibody versus antigen, how to attack and so forth. They have IgA, they have IgG, they have all of these things. So it's still sort of some of the same biochemical processes. So we can still take some of that process and have it to our best benefit as humans. So we do have a product that has that in it. It's called, where are we? SPI Protect. I don't know if this shows up for you guys very well, but here it is, SPI Protect. And so that's got some, just basically that's all it is just the bovine colostrum kind of concentrated down. Now, what that does is it actually helps to support, so we've talked about gut lining support, this actually helps to support the respiratory lining. So again, those very delicate tissues wherein gas exchange takes place. Right? So this is what we sort of miss when we miss the forest for the trees sometimes in medicine. We're putting people on a ventilator, we're blasting them with oxygen, right? That should get them better, that should get them that gas exchange, but what it's actually doing is causing more and more and more inflammation against those little bubbles at the end of the bronchial tract, which are called alveoli. And if they swell, they swell shut, and you can't get appropriate gas exchange there. Okay, so that's part of the problem with the ventilators, what they're finding is, and we've known this for a long time, but I think it's becoming much more evident in the news and kind of getting a light shined on it. Sunshine's the best medicine, right? Is that we're swelling these alveoli and it's making gas exchange near impossible. So we're actually kind of harming patients in a way. Some people do benefit from it. It's not that ventilators are bad. It's just that it's not the answer for everybody. And this is the reason why it's not the answer. So really we need to keep that mucosal lining nice and protected, soft, easy, right? Like I tell my kids when they were little, soft hands, nice, right? So I'm going to be very gentle with it. And so this colostrum, the IgG, IgA, all of these guys that are immune support are going to help to support that mucosal lining, not only so it doesn't have that cytokine swelling inflammation, but also so it doesn't allow viral particles to come in. So this is a droplet transmitted as far as we know. There's some argument whether it's actually airborne, can it travel across the room or not, or is it just really droplet to droplet? Again, still debatable, but it comes through the nose, through the pharynx, or through the back of our throat and goes down into that mucosal lining within our lungs, and that's where it's causing these respiratory issues. Okay, but if you're making an armor such that it cannot cross that barrier and it can't take hold, guess what? You're not getting sick, right? What we sometimes forget about viruses is viruses are dependent organisms. They cannot replicate on their own. So sitting on the surface of your countertop, on the phone, on your computer keyboard, they cannot replicate. Now they can still infect you, but they cannot replicate and duplicate and make more of themselves, right? So they're not going to flourish and make a colony on your phone. Bacteria will. Okay, those are independent organisms. They can just grow. So when you look at your moldy bread, right, that's essentially what it's doing, is just kind of replicating. Okay, in viruses, they can't. They require our cells' DNA to unwrap its own, usually RNA, and to be able to replicate itself and then make new viral particles. So it has to gain access to the cell in order to do that. If we don't permit it to get into the cell because we've protected with a strong mucosal lining, whether that's through the respiratory tract or our GI tract, we don't let it in. And then even if it gets past that, we've armed our cell membrane. So each individual little cell with zinc, with vitamin D, that change that cell membrane, it's going to be a problem for that virus. It's going to be like, you know what, guys, let's bail. Let's go to the next one, right? And that's exactly what we want. We want to be able to empower our own bodies with its own ability to protect ourselves, because we are designed to do this, guys. We don't have to necessarily rely on the pharmaceutical industry to kind of get their collective acts together, right? Again, there are times we need antibiotics. There are times we need blood pressure medication. In fact, I just had 2 patients today. I'm having to start on blood pressure medication. There is a utility for the general mainstream pharmaceutical industry. Absolutely. It does save lives, but it is not something that we need to absolutely 100% be reliant upon. There are things in Mother Nature that Mother Nature has provided for us we can absolutely utilize to our best benefit. How do I feel about using fecal transplants for GI issues? That's a great question. So I'm not as familiar with it. Like, I don't personally do it, but I know there have been some patients who have had immense benefit from it. And I think particularly for those individuals who have a lot of autoimmune issues, that they just don't have good immune function, they really can't tolerate probiotics, or it's just not enough, right? I mean, our body can only incorporate so much of these ingested bacteria and say, okay, maybe you belong here. And then if we have some sort of immune function that's sort of attacking those bacteria and kicking them back out again, sometimes we just need to start over again. And so some of those individuals who do have those fecal transplants do very, very nicely. And so I think it's definitely something that we can work with other specialists about, get you referred over if it's something that you are interested in. I think even just getting a consult with another doctor who does that and say, yes, you are a candidate, or no, you're not. And what's more important, this is the reason why. Right? So don't just tell me that I can't have a certain therapy. Please explain to me why I'm not a great candidate. And then I can better incorporate and understand that education and say, okay, then I need to go down this path instead. So really find that provider that's going to be able to give you that information, kind of put the icing on the top, and not be so patronizing of like, nope, you just don't need it. And sorry, can't help you. Really more of an attitude of like, look, this is why this is probably not going to work best for you. I've seen this in experience. I've had this many patients with X, Y, or Z. They don't do well with it. I'm not going to put you at risk. And then finding the donors and all of this sort of thing. But there are offices out there that actually utilize this and again have had fantastic results. Part of the downside is, again, if we're going back to old behaviors, taking multiple courses of antibiotics, drinking alcohol, eating processed sugars, you actually can now destroy that new flora that you've just transplanted. It's kind of like those individuals who've had weight loss surgery, they've had, majority of their stomach cut out, and they go back and they regain. It's because, again, you can stretch out that tissue again. So we can re-injure knees after knee surgery. So we have to still be very cautious and protective of our new little friends, our new microbiome that has been transplanted in order to maintain it. Otherwise, it will deteriorate again. So we've got to take care of those gifts that we're given when we receive them. So definitely. Well, I really appreciate you joining me today. I don't know. I think that's all I can blab about, really. Again, we have, I forgot turmeric. Oh my goodness. So turmeric is one of my best friends right now. Turmeric is super, super important for immune function as well. And it kind of helps, not necessarily on the back end, but a little further down the road than where your immunoglobulins are helping you, where your zinc and your vitamin D are helping you, although they all have kind of multiple functions. The turmeric actually has a role in the production of what's called NF-kappa beta. NF-kappa beta is one of the precursors that gets signaled. So we have an insult, right? Whether that's inflammatory foods, whether it's a virus, a bacteria, who knows what, right? So angry something comes in, our cell sees it, and it's like, Ma, right? And so it comes down and it unbinds from what becomes NF-kappa beta. Okay, so it takes off a little element and it activates something called NF-kappa beta. That guy jumps into the nucleus of the cell. I get so excited. I'm such a nerd. I love this stuff. So it gets inside the nucleus of our cells, and then our cell nucleus turns on all of these switches for cytokine release, right? It says, we don't like this foreign object, whatever it is, whether it's bee pollen or, who knows what. So it comes in, it's like, well, I don't like you. What am I going to do about you? I need to attack, attack, attack. Okay, so the NF-kappa beta sort of is the messenger that then deploys the army of cytokines that come back out and attack that antigen, so that offending agent, again, if it's a virus or bacteria, right? The problem with it is the cytokines in and of themselves will come back and continue to stimulate that messenger, that NF-kappa beta, okay? So then it keeps going into the cell nucleus again and says, hey, make more, make more, make more. And then this becomes the problem with cytokine storm, is that we set off this, what is initially an immune system, and it's a normal function and it should be happening, it's good, then becomes bad. Now we have too much, right? So it's kind of like deploying an army for a skirmish, right? And then we just keep fighting, even though the skirmish is over, we're now killing all the regular citizens. And so that's not good. That's when it becomes really problematic. And that's what's happening with cytokine storm. And we're finding that's one of the major issues with people who aren't recovering well from COVID-19, is that they're getting into this cytokine storm. So how do we stop it? Becomes the question. So this was why they were initially looking at hydroxychloroquine. And without blowing up my messages over here, hydroxychloroquine works on IL-6. We think it has some element of IL-2, IL-8. Okay, so these are interleukins. These are the cytokines that I'm referring to. And so it helps to modulate those. Okay, it shuts them down a little bit. Okay. NF-kappa beta, however, is the one that signals the production. So we want to really stop NF-kappa beta, much more so than on the tail end of like, oh, let me kind of play whack-a-mole and get all these army soldiers back in place. Rather than that, let's just not deploy the army as heavily, right? Send in this many troops, not this many troops. And we're probably going to fare better, right? So that's where turmeric comes into play. Resveratrol is another element that comes into play as far as that's concerned. So these are really, really important regimens to have, again, in your armamentarium, of how to arm your immune system to its best benefit, okay? You want to usually take about 450 milligrams of turmeric twice a day. It's also great for just inflammation in general, right? Remember, NF-kappa beta is like then responsible for that inflammatory chain. So we're talking about joint aches, headaches, brain fog, fatigue, all of these elements that can affect us. So I take it because I have chronic hip pain, right? So my last kid weighed 9 pounds, 10 ounces. So it was a lot. So I have a lot of hip pain. I just take my turmeric every day, and actually minimizes the amount of any Tylenol, Motrin, anything else that I have to take in the way of analgesics. So it's really, really important. So I have one up here. Turmero is from one company. I am not brand loyal, so I will use whatever I can use for my patient's benefit. So I have Turmero. I have Turiva, which is an orthomolecular product. That's actually the one I'm taking at home. And then we have it in a liquid form as well. You can get it in tea. Actually, my husband drinks turmeric tea every day. It's not a bad flavor. Honestly, it's actually a really nice, soothing flavor. You can put it in your cooking, like on chicken. You can put it on rice. It's a fantastic root, actually, is where it's from. But it's hard in a dietary setting to get the level of milligrams that you need to be really very effective at kind of modulating this cytokine response. So that's why I would recommend probably a capsule or a concentrated liquid form rather than just relying on the tea alone. Now, if you have regular aches and pains, you've got rheumatoid arthritis, and you do great with 2 cups of turmeric tea a day, great. Do that. Definitely you don't need to buy a supplement. But if you're really looking to arm yourself, or you know that you're immunocompromised for any reason, then definitely look into getting a supplement for yourself. And again, target is about 450 milligrams twice a day. And it, again, is then reliant on gut absorption to be effective. So still coming back to that gut health. There were studies done, again, look it up. Fact check me all you like. There were studies done with IV turmeric and getting those levels up, those serum levels up to where they should be to help modulate. And we had very good results from that study. However, turmeric is not available IV commercially. At least I haven't been able to find it. If anybody knows where I can find it, great. I'd love to offer it to my patients upon some more research. But again, people are looking at these elements in the literature. So it's not that I'm just talking out of the clear blue sky and I read some herbal medicine book from, Native American, whatever. There's something to be said for these ancient cultures and these ancient systems. They knew something was of benefit in these herbs and these roots and these plants and so forth. There was something to what grandma tells you when she's like, oh, drink this tea. She's not lying. It's just that in conventional modern medicine, we haven't looked at it enough to really know enough about it to say, yeah, this is how many milligrams you need to take, or yes, we have it in this supplement form over here. So it hasn't been given the credibility that I think it really deserves. But there are absolutely things out there elementally in the community, in the natural world, that are here and available to you to build your best immune health. So I really hope that this is helpful for you. I appreciate you for tuning in. We'll be here next Wednesday. Don't forget Field Trip Fridays. So make sure that you click like and subscribe and notifications. That's the one. You want to do the notifications so you get notified anytime there's a new video coming out by me. We will have Field Trip Fridays this Friday. Look forward to seeing you soon. What's up, kid? Hey, we got a new person comment.